Good morning, everyone. Today's session is going to be really helpful and is led by Dr. Ruchi. She's going to talk about what to do when you're pregnant for the first time. So, stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you for your kind words. I'm Dr. Ruchi Tandon. I'm practicing gynecologist and obstetrician at Apollo Cradle, Nehru Enclave. Congratulations. You are pregnant for the first time. First, you have to decide whether you want the pregnancy or not. If you want to be a parent, schedule a prenatal visit, start on prenatal vitamins, and follow the following steps. If you don't want to be a parent, you have options as well. So you went to a pharmacy, you brought a pregnancy test, you peed on the stick, and then you waited for those 2 minutes, after which you tested positive. Now what? First, breathe. Whenever you have the result, you can choose to continue the pregnancy or not. Chances are that there will be a million questions in your head, there will be a million emotions, and you will not be able to think clearly also what to do or what not to do. uh, Pick up your doctor with whom you feel comfortable so that you are able to share your news with them and with someone whom you can trust. Not only this person is going to deliver your baby, but also you'll be seeing them a lot through the next 9 months. Most offices operate as a group, so it's also a good idea to get to know that many health professionals are readily available to take care of you. During your pregnancy, you should generally expect to see your gynecologist at least once a month, until the week of 28, twice a month from the week of 28 to 36, and weekly from the week 36 onwards. If you have a high risk pregnancy or any complications, you might need some additional appointments and some additional tests and probably more frequent ultrasounds. Third most important step is to schedule your first prenatal appointment. Your first prenatal appointment may involve confirming the pregnancy with blood test, ultrasound, blood work, and most probably your gynecologist will be asking you detailed questions such as if you have any previous medical or surgical histories, if you're taking any prior medications, and if you want to start off on a healthy pregnancy. Your due date is usually calculated from the date of your last menstrual period, and sometimes it is confirmed with an ultrasound. A lot of things will be discussed, such as what to expect when you're pregnant. Be sure to ask your treating gynecologist a lot of questions. This is your first pregnancy, so feel free. Feel free to feel free to write down your questions prior to your appointment so that everything can be discussed in an appropriate manner. You should let your treating gynecologist know if you are experiencing any symptoms such as bleeding, cramping, or pain, SOS. The fourth most important thing is to start supplements. Prenatal supplements are usually folic acid. The recommended dose of folic acid as per the ACOG and the Center for Disease Control is 400 mcg of folic acid. Most of the supplements that are available are 5 milligram. Prenatal vitamins are important because your newborn baby's neural tube develops in the first 12 weeks, which later becomes the brain and the spinal cord. Folic acid helps in reducing neural tube defects and irregularities that occur, especially things like spina bifida. Other thing your prenatal vitamins should contain is calcium, vitamin A, C, D, E, vitamin B12, zinc, copper, magnesium. Your gynecologist will also recommend separately an iron supplement if you are deficient in iron and if your hemoglobin is low. DHA is also an important supplement for the baby's growth and function. The fifth most important point is to discuss your medication with your gynecologist, particularly if you are on antidepressants, if you are on pain medicines like Brufen, if you have been taking some kind of anti-allergics. The sixth most important thing is make a work plan. You may be having some maternity leave. In India, in a lot of government sector jobs, maternity leave of 6 months and CCL care, that is child care leave of 2 years, is given in most organizations. In a lot of private sector, 6 months of maternity leave is given, which is generally preferred in the latter half of the pregnancy. However, you can plan your leaves, you can plan your workplace schedules accordingly. Seventh most important point is to cut down on alcohol and substance abuse. You should quit smoking the moment you find out you're pregnant or you want to continue the pregnancy. Eighth most important point is decrease your caffeine intake. ACOG recommends 200 milligram or less of caffeine per day, which is approximately 2 cups of regular coffee per day. Research shows that more than 2 cups of coffee can increase your rate of miscarriage. The ninth most important point is brush up on your nutrition. You should be hydrated with 2 to 3 liters of water. Eat balanced meals containing a lot of vitamins and minerals, complex carbohydrates, healthy types of fat, protein, fiber. Foods such as whole grains, legumes, vegetables, cooked lean meat are great choices. Foods that you should avoid during pregnancy include Chinese food because they have MSG, high mercury fish such as swordfish and large tuna, sushi, undercooked or raw meat, raw sprouts or raw or uncooked food, unwashed fruits and vegetables, and unpasteurized milk and processed food. 10th most important point is get ready for morning sickness. 70 to 80% of people experience some kind of nausea of pregnancy, which is completely normal. It can happen any time of the day or any time of the night. It begins generally around 6 weeks and it ends with the first trimester. For some people, it can be exaggerated. For people with multifetal gestation, for example, twins or triplets, it can be more. If it is excess, it is called as hyperemesis gravidarum and it is not a normal condition. Please discuss this with your treating gynecologist. There are certain remedies which can help you in combating the nausea of pregnancy. This is doxynate or vitamin B6. There is also anti-nausea bands which are available, some kind of salty crackers, lozenges, ginger tea, candies. They all help in combating the nausea. 11th most important point is be aware of the warning signs of miscarriage. Call your gynecologist if you experience any symptoms such as bleeding, cramping, pain, foul smelling discharge. These are abnormal signs, or they are the signs of miscarriage. Even though 1 in 3 or 4 pregnancies ends up in a miscarriage, our aim is to give you a comfortable and to give you a viable and healthy pregnancy. Miscarriage does not mean that it will recur. The recurrence rate after one miscarriage is less than 10%. The recurrence rate after 3 miscarriages is less than 30%. Everything is treatable if it is done appropriately and under guidance of a treating gynecologist. Feel free to discuss all your queries with your gynecologist. We are available at Apollo Cradle to help you and to make your pregnancy smooth. If at any time you feel you are suffering from any kind of disease or any kind of symptoms which is not making you comfortable, you can reach us even via an application of Apollo. Thank you so much.